Alright, so first I'm going to stay quiet. I'm going to check my physician's orders, check my allergies. I'll assemble my equipment and assess my patient. I'll wash my hands. I'm going to introduce myself and identify my patient with 2 identifiers. I will provide for privacy, and I'll explain, educate, and evaluate. So the first thing I'm going to do is ask my patient if she has any nasal trauma history, such as a deviated septum, nosebleeds. Then I'm going to have my patient cough. I'm going to check for gag reflex with a tongue depressor. And then I'm going to make sure my nasal airways are patent, so I'll have her blow out this side and then the other side. So first I'm going to go ahead and sit my patient up. We're going to pretend like she's sitting up. High Fowler position. I'm going to go ahead and pour my water in here and get that ready. Okay. So I've listened to lung sounds. So now I'm going to check patency of my tubing.
So before the procedure, before it even starts, I start suctioning and shit.
And I see that it's flowing just fine. So now I'm going to measure, starting at the tip of the nose to the back of the ear, down to the xiphoid process. And then I would mark this with some tape. And now we're ready to start placing this in my patient. So we're going to push till we hit resistance. And then at this time, we're going to ask her to have her cup of water and straw ready to start drinking. So we're going to have her, as she would be sitting up straight in the high Fowler position, she would lean her head forward and we'd tell her to drink, 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 swallow, 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 and you'd start pushing this all the way down. Let's see. This would go all the way down and pretend like it's all the way down. Then we're gonna tape it to her nose. And just wrap this around. And wrap this one around. Pretend like that's sticking better. So now that we have this placed on her nose and it's went all the way to where we had marked, we are going to check for stomach content. So we'll aspirate slowly, and we do see stomach content, so I'm going to replace that slowly. So now we will send her to x-ray, make sure placement is there, and also you could listen just for placement. So now that she is back, it is in the proper place, we'll tape it to her gown, and then I will hook her up to suction. It is low intermittent suction, and no more than 80 on her rate. So I now have her attached to suctioning. Turn it to low intermittent, and I see that there's 100 milliliters of black coffee grounds, and I would document both procedures, and that is it.